Hi, my name is Emily Correa.
My name is Hannah Green.
My name is John Polvey.
And my name is Mariana Lika.
This is our phone dialing BCI, which we will discuss in the following slides. For this project, we wanted to create a BCI which would not only improve communication, but increase the independence and autonomy of the user. A phone dialing BCI met both of those criteria. Without a device like this, it would be difficult to get in contact with other people without assistance from another. This device would allow the patient to call others independently. We did consider the presence of voice-activated assistance, but this is often unreliable and frustrating. Any EEG device would be much more dependable. This BCI is meant to help those with below-the-neck paralysis who still retain the ability to talk or facial autonomy. Some examples of this are patients who are quadriplegic, paraplegic, or have ALS. It will fulfill the need of the patient to communicate independently over longer distances.
On the screen is an illustration of what the device would look like. As you can see, the headband design allows the proper brainwaves to be read, which include signals from C3, CZ, C4, and O2. There are 13 commands we would like to utilize for this device, the first of which begins with initialization. This will be accomplished by the patient closing their eyes until alpha rhythm is established. This should take approximately 2 to 5 seconds. The other 12 commands will be accomplished through imagined below-the-neck movements. The patient will imagine bending individual fingers to the palm for numbers 0 through 9. Likewise, they would imagine making a fist with the left hand to make or hang up a call and with the right hand to turn on the voice assistance to call pre-programmed contacts. Although some assistance is required for the initial setup, this device allows the user to freely make phone calls on their own.
The patient will wear a wireless and non-invasive EEG cap in order to collect the signals, which will later be transmitted via Bluetooth to their smartphone. The device will have software for signal processing, specifically a bandpass filter and artifact removal. Once the signals have been processed, we can use offline analysis to do a final check on whether the data is usable. The filtered usable signals can be compared to known signal patterns in order to identify what the patient is intending on doing. And when the signals match, it will perform the desired action based on the patient's input. Having a wide sample of EEG signals will be useful for this stage, so there is a margin of error for the input signal, but we must still maintain a certain specificity to limit getting the wrong output.
The electrodes will be placed at C3, CZ, C4, and O2 scalp areas. These placements will allow us to monitor signals from the hand area as well as the opening and closing of the eyes. Alpha rhythm will be monitored at O2 to determine when to start and stop commands based on the eyes being closed or opened. Beta rhythms will be used for all other commands by recording the brain signal as the patient imagines movements of the hands or the fingers.
Our flowchart begins with initializing the patient's EEG device and describes the recording and signal processing steps. From there, we have multiple checks to identify whether the data is usable and good quality. Then it moves on to the next branch where the data will be analyzed and compared so the software will determine what the input is trying to accomplish and output the appropriate action on the patient's smartphone.
The market for non-invasive BCI has been growing for the past 30 years, from medical, clinical applications, assistive technology, to gaming, and even market research. There are no major risks associated with wearing the headset, as it is non-invasive and used only for reading of the brain signal. However, some users who have sensitive skin might feel a mild discomfort after wearing it for an extended period of time. The headset is connected to the external device via Bluetooth. Thus, there are no cables for risk of electrocution, and the output is 1,000 times less than a phone's electromagnetic output. The headset would have adjustable size to accommodate for different head sizes. This feature would ensure accurate placement of the electrodes over the intended area and comfort to the user. The headset would include rechargeable batteries with 9-hour battery life, allowing the user to utilize the headset for most of the day.
Listed here on the slide are the resources used in our project development. That concludes our presentation on the phone dialing BCI. Thank you for listening.